Well, we're here with the Addis Clinic staff and Dr. Paul Hart, a retired family medicine physician who volunteered on 85 cases with the Addis Clinic in 2020, a year that was no doubt one of the most challenging for global and public health. Out of more than 100 volunteers, he supported more frontline health workers in East Africa than any other of our volunteers with timely advice. He was a mentor to dozens of health workers, many of whom he now interacts with personally. Dr. Hart, the Addis Clinic has grown a lot in the last year. And with any sort of growth, there will be problems and challenges. This year has proven that. But in addition to volunteering your time, you've also given us advice about how our organization can improve the way we interact with health workers in the developing world. Can you share a little bit more about opportunities that we have as healthcare professionals in the United States and other parts of the world interacting with lower and middle skilled health workers in East Africa?
Sure. First of all, it's been a real pleasure to work with the Addis project. I look forward to the cases I get. I'm learning, I'm sure, probably as much, if not more sometimes, than the people I'm helping. There are many opportunities. We're fortunate to have a lot of resources, which unfortunately not all providers around the world have. So some of the things we can do is make people aware of what resources are available at no cost. For example, the New England Journal of Medicine in any third world country is free to every provider. So if we make information like that available to providers and let them know a little bit about the journal, what they can expect from it, it's an opportunity that people have. Also, to look at the needs of providers and try and develop either tick-off sheets or lectures that can help address those needs. In other projects I've been at, what has happened is people, the providers, be it in the former Soviet Union, have said, we need help in this area. Please update us in, what's the latest techniques in helping with hypertension, diabetes, arthritis, I don't care. Those are the opportunities that we have in Kenya, where we can reach out to now, I don't know how many different providers in Kenya use the service, but we can reach out to them and say, what can we do more to help you than help you with an individual patient? Is there any area that we can help you with? And we have amongst our providers here a lot of expertise. We have specialists who could address a question about endocrinology and how do we help and what's the latest we do with childhood diabetics or with people with thyroid disease. I don't care what the condition is, but I think we have the opportunity to do that. And then of course to make ourselves as available and as timely as we can to the people in Africa. They've been a wonderful group to work with. I now feel that since some of the folks I've had 2 or 3 cases with, I'm getting to know them and I think they're getting to know me, and it's nice when I get a question back. Okay, I get what you told me, but what about? Or, okay, if I want to use this medicine, how would you start using it? I'm not that familiar with using this medicine in this case. And we can develop a dialogue. And even though we're many time zones away, I constantly check my computer to see is a question coming up to make it as quick and a response as I can to the folks there, and they turn it around quickly to me.
And these exciting opportunities that you're describing, I think, help bring the Addis Clinic closer to fulfilling our mission. Our founders, Dr. Stephen Chan and Dr. Katie Cahill, wanted to do more than just provide a one-time consultation through a physical, direct, medical mission trip. Instead, they wanted to foster relationship building. And what we're doing, more than telemedicine, is telementorship, telecollaboration, and other contexts. And you have proven that dedicated responses to our health workers can provide that. So I'm going to toss it over to Megan now for the next question.
Dr. Hart, thank you again for all of your dedication this past year. It's been phenomenal to get to know you and to learn a lot from you personally and professionally as well. That being said, do you have a memorable consultation from 2020, a case that was particularly impactful to you that you'd like to share with us?
Oh gosh, there have been so many different, one thing that which has been interesting is the variety of the cases and sometimes the complexity. I was a family doctor, and besides doing my family practice, I've done some urgent care work. If I look at how difficult some of these patients are, they have multitude of problems. There are limited resources, which unfortunately the providers can access to help with the diagnosis. So I've had patients who've had a head injury in a situation where they would have to be transported a good distance to get CAT scans if that was available, seizure disorders where they present this one I'm thinking about, this patient had been treated very appropriately with a first-line drug, had come in, was not doing well, and the question is, what do we do next? And so there have been, patients who are complicated with HIV, with TB, with, women who have the responsibility for their family, but they're so ill that they haven't been able to take care of the family. Or they always ask a question about being providers. And many times you see that the patient is a provider for a family and now can't work. So, what I've most been impressed about is the complexity, variety that these providers in Kenya are faced with. And it's difficult. If I look at some of the patients, I'm sure if they showed up here in the hospital, we would have 4 or 5 different specialists descend upon them to try and help. And it's one doctor and one provider in Kenya who's trying to work the whole thing out with, as I said, limited resources. And they send me very nicely the lab result, the x-ray. And when they send me the lab results, they're good, but not as extensive as I would have gotten from a US hospital. And this is what they're forced to work with. So it's challenging also for me to say, well, what do I do with these limited resources to try and help in people who are faced with a difficult patient?
Yeah, seems to give a new layer of meaning to the term healthcare heroes that we've been talking about all year. I mean, not only do we have frontline healthcare workers on the front lines of COVID-19 pandemic, but people in the developing world working with very limited resources to protect their communities along all sorts of illnesses and complex contexts.
And I don't know if we have the healthcare, I really, really appreciate the honor that you've given me. The award should also go to all the providers there in Kenya and I've said that to them, and I thank them, I hope every time, for the service that they're providing to their patients in really, really difficult situations. And they're doing a wonderful job of doing it, and they keep doing it. And I hate to think how many patients are coming into their clinic. I love physically to be there, to be with them and just to, physically help out. This is the best we can do now until COVID becomes more manageable.
That's right. Well, Anthony, do you have a question you'd like to ask Dr. Hart?
Hello, Dr. Hart. It is a pleasure. It is a pleasure actually seeing you. I love the shirt too. I don't know what it means, but I love it. Yeah, and it actually, for the fact that you understand how it goes, how we take it here in Kenya, how things run, the fact that you came on board and you have realized the challenges the healthcare recruiters face, the healthcare workers face, kudos to you for taking that step and going down on them. And then sometimes, actually, I will apologize because some of them may send some the history is not that well written. Sometimes they may not realize when they send a case, it has to be accompanied by some tests. But sometimes they can't access these tests. And the fact that you realize that, that's good, because we have had some problems sometimes when a healthcare worker sends a case, they can't access the test. The physician asks for the test. The healthcare worker sees as if we are getting complicated and decides, since I can't get the test, let the consultation end there. But for you, we see that sometimes these cases come with only the history. The healthcare worker is in a very remote area. The nearest CT scan, or let's say even a fully as a complete blood count test or machine is, let's say, 50 kilometers away. When you have decided to try and navigate that, we really appreciate. But I think I had only one question for you.
Yes, sir.
In all the consultations that you have had in Kenya, let's say the 85, what trend have you noticed? Where should we change, or where should we improve with the healthcare workers that we are with? What what's in the capacity of the healthcare workers that you are working with that we can improve, or as the Addis Clinic can improve too?
It's an excellent question. And I think our job here from the Addis Clinic should be to help the healthcare workers with their knowledge base, because it's really easy for me to sit back here and say I would like A, B, and C done, but realistically, as you know, I've got to be in their feet, and they don't have the luxury of all the facilities we have here. And what I think we can best do is say to them, okay, when you're sending a case, ideally, this is the information we would like. But if you don't have it, don't worry. Give us as much as you have, and we have to realize that that is what they have. And maybe I can help by saying, okay, I appreciate this. Maybe you can find out something else, but you may not be able to, and I have to understand that. You know, I can ask for a lab test, but I have to realize that I can't get it. I mean, I've been in Ethiopia, in remote areas where it's the same way, and in other countries where we don't have access. So I can't be critical. It's wrong for me to be critical. I mean, just the fact, this is a brand new way of doing medicine, not only in Kenya, but for a lot of doctors in the States. I was on a call the other day where the person said, I've never Zoomed before in my life. This is a new way of doing things. And we have to realize that this is a new way. This is a new way of getting medical advice, to enter into a form or onto your computer, all these questions, and then get an answer back. And what I was discussing earlier on is, I think it's incumbent upon us from the States to give either forms or suggestions to the providers there to say, it would be more helpful to us if you can get. And if you can't get, give us the best that you can. And we understand that, and we'll accept that, and we can work with it. You know, I could always ask for more information, but that's no different than if I was here in the States and I was dealing with one of my colleagues and I say, sure, I could use more information. But we've got to be realistic. They're doing a phenomenal job given the limitations. And I don't think I can ask more from them. I think I have to give them more help and more suggestions. And I'm sure they'll pick them up, because the people that I've dealt with, when I've dealt with them a number of times, it seems that our communication is easier and is better because they know more what I'm looking for just from our conversations. And then I do ask, sometimes I say, okay, I don't know how much to write. Sometimes I write too much or I give too much. But, if you want more information on this particular topic, get back to me. I'll gladly do it. But I don't want to overwhelm you with information when you're faced with all the patients to deal with. So, sorry, I'll turn off this, whatever these beeper is. There it is. But I really, as I say again, I think it's more incumbent on us from the Addis Project to reach out and to educate as appropriate, if I can say. We can't ask for every bit of information we'd like. You can't give that to me, but it's just not, feasible, or, I think that's the best answer I can give.
And that
Yeah,
really
I really appreciate the answer, because I think you understand that the people that you work with mostly are nurses and clinic officers. Clinic officers in your country in the level of a physician assistant, they know how to take a good history per se. Some of them take very good histories. Some of them are in facilities that they just prescribe drugs, and that's all, because mostly they don't encounter serious cases. But when they encounter, they use the Addis clinic. So sometimes they, let's say a head injury patient, sometimes they forget to take a GCS score of the patient. Currently, sometimes we have to remind them, this patient, if it's a head injury, include a GCS score. They have not, what they learned in school, they have not used that much as we expect them to. But a good thing that you realize that, and you take it upon yourself to ask the questions, rather than pushing the healthcare worker, get this patient a CT scan. And you see now, if somebody that, a CT scan here in Kenya will cost not less than $90 to $150. And I can tell you frankly, $90 goes away to it helps a lot to such a patient, but that's only for the CT scan. That CT scan is around another 100 kilometers away. They have to book for it. So it takes a lot, and it your help.
One thing that I could ask you to ask your providers, what would they like from me and other volunteers in the form of information? Would they like me to send them an update in different conditions? How do you manage, I keep using the same examples, high blood pressure? What do you do when a patient comes in and the blood pressure is elevated? What are the first steps? What are the first medicines you would consider? And that has to be said with the understanding that I don't know every medicine that's available in Kenya, and I'll need your assistance from it. And I don't know the costs of medicine there, and I would need your assistance. But, what things do you look for? What questions you want to ask a patient with high blood pressure, with diabetes, with headache, with upset stomach? What do you want to do on a physical examination? Because they can't do a complete examination on every patient and a complete history. That you just don't do that. It's not feasible. They're in a clinic setting where they're dealing with a specific problem. So if you want to reach out to your providers and provide back to me, I will gladly put together, and I'm sure with other volunteers, a series of information sheets which we can send back to them. So when they come up with that situation in the future, they have something to refer to. And then if they have a problem from that, of course, I want to be here anytime they need me, but at least they would have something that is there they could just turn to right away and say, oh, okay, maybe I'll try this now. Maybe it's appropriate. So that's something that I think we could be very helpful with. And then when they reach back out, they said, okay, well, I did what you suggested first, and I don't think it's working. What should I do now? And that's where our role should be, to help.
That's very helpful, Dr. Hart. And, Anthony and I have actually been speaking about that in the last couple of weeks, and, targeting, non-communicable diseases that are really growing in this area of the world in a way that they had not previously, such as you mentioned, hypertension and diabetes, hyperlipidemia. And those are all things that many of our providers could utilize, more information regarding. So
and
we'll
even
certainly be in touch with
right,
you about that. And
right.
Anthony is actually going to be gathering the information about the medication and available therapies that you were just speaking
Yeah,
about for us to relate
and
to
it
you.
doesn't have to be new diseases, because if you look at any of our continuing education courses here in the States, they always review still basics. There's no harm in going back over diseases that we see on a regular basis, just making sure we're treating them and diagnosing them as appropriate. There's no harm in review, and so we can do it both for the COVID, etc., but also for the diseases that they're seeing day in and day out.
Absolutely. Thank you. We're excited about doing that with you.
I love to do it. It's fun. And, because of COVID, I'm at home. I want to do stuff and maybe helpful this way.
Well, hopefully, maybe at the earliest this fall, we'll be able to invite some of our volunteers like you and some of our donors and other partners from the United States to go visit some of the sites in Western Kenya. It would be this fall at the earliest, but if not, then we will wait until it's safe and look forward to that gathering. One last question before we wrap up, and I think you may have already answered this, but as we seek to recruit 1,000 more health workers in Kenya to use telemedicine, we're going to have a massive push to recruit more volunteers in the United States to respond to requests for help. What would you tell a physician, a physician's assistant, a nurse practitioner that wants to volunteer with the ADISC? What would you tell them in terms of expectations and how they can be most useful in this endeavor?
That as I said before, it's a great project. It helps, not only am I helping somebody in Kenya, it has me review and think about these problems. And that is extraordinarily helpful. I have looked at, I don't know how many conditions again, and been in the situation of saying, what is the cause of this patient's problems? How would I approach it? And trying to put it together. And it's problem solving without having the patient in front of you, with having the information. I go and I use many resources to try and say, okay, am I right? And it's in one way is more difficult than the patient being in front of you. We can turn to them and saying, are you having blurring of vision? On the other hand, it's very rewarding, because when you get back an email, which I do, is saying, oh, we tried this and the patient improved. That's great. You know that you've helped not only the patient, you've worked with a provider in another country, and you're building bridges. And I enjoy that. I don't know all the providers there, but I'm getting to feel that I know some of them, and they're wonderful people. So you get a chance to meet new people, to work with a group. And since it's nothing that you have to do right at the time, you don't have to stop what you're doing. You know that they want a turnaround time. I try to do within an hour, but I'm neurotic. But you've got time to think about it, to schedule it into your day. And at the end, you say, yep, I've done something really, really worthwhile and made a difference. And I think, how often can you do that these days? And providers to be able to reach out. And, it doesn't take all that much time. So, for somebody who's in active practice, and I'm not, you still could say, okay, in the evening, after supper, I could go and look at that problem and say, what do I do about this type of rash? Or what do I do with the patient with a headache? It's a great opportunity. I think we should reach out to, and I will, to as many physicians and nurse practitioners as you can. I learned about your wonderful project from the Maven Project, which is only working here in the States, and they introduced me, and I think we should reach out to all these other projects which are working even within the States and say, look, here's an opportunity to work internationally and volunteer with a group that is really doing a great job.
Absolutely. And with COVID-19 cases that might be on the rise in Africa in 2021, we will hopefully be expanding to other countries and other contexts as well. And so we
sure.
need many more hands on deck. One last thing, again, you did volunteer the most cases of any of our volunteer medical corps in 2020. And we're going to be mailing this to you. It's a beautiful canvas of Maasai warriors that came from Kenya that's framed. And
Oh, thank you.
token of our appreciation for being our volunteer of the year in 2020. This is our first award for the volunteer of the year. And I don't know if we've calculated how many hours you've spent, but they were
You know what?
valuable hours.
I love the hours, and the time goes quickly. And it's not that it's for me, it's not a burden. I love doing it. And I look forward to getting cases. As I said when we started the phone call, I haven't had enough cases yet this year. So, I'll never say no to a case. And if you want to send me 2 or 3 cases a day, I'd love it. I really, really, it's something that I look forward to. It's become a very enjoyable part of my life. And I want to continue as long as I'm capable of doing this type of work. And I'd love to be over there and meet the actual folks who are sending the cases and get a chance to thank them for their work.
Well, thank you, Paul. Megan, Anthony, do you have any final thoughts?
No, thank you so much, Dr. Hart. We really appreciate you, and you were
It really, really is a pleasure, and thank you. And thank you for the award. I really didn't expect it, and it's a real surprise. And thank you, and for the lovely gift that goes with it. Thank you. And it's great to see you in Kenya over there.
Thank you, Dr. Paul, and say hi to the beautiful lady behind here.
Okay, thank you. Will do. It's my wife. Thanks.